Automated External Defibrillators, AED, can help save lives during sudden cardiac arrest. During sudden cardiac arrest, the heart stops suddenly, and in 90% of the cases, the heart goes into a fatal rhythm known as ventricular fibrillation. The only treatment to correct ventricular fibrillation is to defibrillate by applying an electric shock to the heart. AEDs provide the public with access to defibrillators. They can be used on a victim of any age by people with no medical training. Remembering the steps to use an AED the right way can be difficult. In order to help keep your skills sharp, following a quick step-by-step guide that you can print up and use when needed. These AED steps should be used when caring for a non-breathing person. First, power on the AED. An AED can be used on an adult, child, or infant. Follow the AED prompts. Place the AED near the victim's head and power on the unit. Some models require you to push a button to turn it on, while others turn on automatically when you lift the lid. Second, apply the AED pads. Expose the chest and wipe it dry of any moisture. Apply the pads to the chest according to the pads. Place one pad on the right side of the chest, just below the collarbone. Place the other pad on the lower side of the chest. Connect the pads to the AED if they are not already connected. If there are two trained rescuers, one performs CPR while the other prepares the AED for use. The rescuer in charge of the AED will apply the pads around the hands of the person giving chest compressions. Do not stop CPR while the AED is being readied for use. The AED will prompt you to stop CPR when it is ready to analyze the heart rhythm. Third, clear the victim and shock. It is critical that no one touches the victim or his clothing while the AED analyzes or delivers a shock. When prompted by the AED to deliver a shock, the AED user quickly looks up and down the entire victim to ensure no one is touching him and loudly states, "Everybody clear." The rescuer can now push the shock button.